countries using conventional methods. And secondly, we also wanted to use more detailed dietary assessment methods, in this case, a food diary. And another thing in the kind introduction Dr. Donovan said that is my interest is to endeavor to use more precise methods, going beyond the food frequency questionnaire wherever possible, both in terms of self-report and in terms of biomarkers. So these were two linked objectives that we tried to address. So to address objective one, this work is published in the American Journal of Clinical Nutrition just about 18 months ago or so. And Yvonne Schlaus was a PhD student then who came to work with me from Utrecht in the Netherlands, and now she's a postdoc. So she did a fantastic piece of work here. So for this work, we worked with the INTERACT study, which is a large study funded by the European Union under the Framework 6, FP6. And for those who are interested in methods, we did publish the methods in Diabetologia. And this study is based within the European Prospective Investigation into Cancer study, the EPIC study. And of the 10 countries that is the EPIC Europe study, INTERACT included 8 of them, including both northern countries all the way down to the south. The design we have used here is a nested case cohort study within EPIC Europe, and that is the name of the study, EPIC Interact. Therefore, this is a prospective study nested in a large prospective cohort. The distinguishing features are that it is large, it's about 500,000 people, of whom 340,000 were eligible for this work by virtue of having blood samples available and detailed dietary information, because the purpose of INTERACT, as the name might be alluding to or suggesting there, is to study the interaction between lifestyles and genetic factors. So we did need the blood for the DNA, hence the eligible sample. We have long follow-up of nearly 12 years. We had nearly 4 million person-years of follow-up, and we assembled what we believe is the world's largest data set of incident cases of type 2 diabetes. So these are people who at baseline did not have diabetes, they did not have prevalent diabetes, and we followed them forward in time. So here we have exposure heterogeneity by virtue of these different countries across Europe. So drilling down into the method of the study, if you imagine this bigger circle as the entire cohort that had the eligible sample of 340,000 people, from that we we ascertained type 2 incident diabetes cases in the entire cohort. So that is all the cases occurring and verified as well. So unless a case that we ascertained was verified by external information, we did not count it as a case of diabetes. We then selected a sub-cohort which effectively serves as a control group. Our exposure, of course, is dairy product intake. And here are some important bits of information. We used a case cohort analysis which was suitable for the case cohort design, because you will note that there's a small number of cases that appear in the sub-cohort, but that is by design because it's totally random. So it also brings in some future incident cases, just a small number. We used the residual method where we adjusted the dairy intake for energy intake, but we also ran a standard multivariable model. We did a random effects meta-analysis across the 8 countries, and we adjusted the analysis for a range of potential important confounding factors, an issue, as you know, that was discussed earlier in one of the talks. We also did a range of sensitivity analyses and robustness analyses to test out whether our findings stood up to further challenges. So on to the results. We set out to look for heterogeneity in exposure, and we got it. So this is data in men and in women. And what this shows is that across the countries of Europe, spelled out here, there are wide variations in the types of dairy product intakes. So in the UK, milk intake is high, for example, in men and women. In France, no surprises, the intake of yogurt and cheese intake is high, and other variations to go with it. Okay, so on to the main results. So these are forest plots that show the results for the association between total dairy products and the risk of incident diabetes by each country, and then pooled across the entire sample. And note that these comparisons are for the highest fifth of intake versus the lowest fifth of intake, but we've also examined p-values for trend, and we've also done dose response analyses in a separate approach. You will note that our model presented here is our, if you like, the maximally adjusted model, which includes a whole host of factors that are considered relevant to this association because they may distort the findings. And as well as the standard things you would expect in terms of risk factors for diabetes, we have also included a range of dietary factors. And in the sensitivity analyses, we had even further dietary factors, including, for instance, sugar-sweetened beverages, which are known to be related with diabetes, and certain other factors too. So what this shows is that in the pooled sample, there was a null association between total dairy products intake and incident diabetes. Moving on to milk intake, we also found an overall null association. There is a hint that there's a slight increase of 10%, but of course that is a sort of false perception in the sense that the 95% confidence intervals do overlap unity, and therefore that's a null association for milk intake. We examined yogurt and thick fermented milk intake together because in this study we were unable to separate the two because of the high thick fermented milk intake, particularly in places like the Netherlands. And overall, while there was a tendency towards a reduced risk, it was just overlapping unity, so it was not significant. Cheese intake was an interesting one, where there was a 12% reduction in diabetes incidence. The P for trend across the quintiles of intake was significant, but in the overall Q5 to Q5 comparison, this was not significant. However, a priori, when we also looked at the combined fermented dairy products intake, now we combine yogurt, cheese, and thick fermented milk, we found a significant association in the inverse direction with a 12% reduced risk of incident diabetes here. In this work, we were unable to separate out high-fat and low-fat intakes because of the nature of how the data were collected with dietary questionnaires, food frequency questionnaires. In these studies did not permit us to do that. So conclusions from this objective, from the first piece of work, acknowledging the strengths and limitations, which I don't have time to go into, but very happy to discuss. There was no association for total dairy product intake, but there was an inverse association for fermented dairy products. And we felt that this deserved further interrogation, and hence why we moved into our second objective. For this, I'm grateful to Laura O'Connor, who's my postdoctoral fellow, who worked on this study in now the EPIC Norfolk study, which is again part of the same study, but in the UK component of the EPIC Europe study, we have collected much more detailed dietary data, which I will show you in a minute. So here we have used the food diary, and this was a prospective food diary which collected information on habitual diets in dynamic time recording for 7 days. You're not meant to be able to see the detail there, but I think you'll get the idea that as opposed to a food frequency questionnaire, where you have the pre-specified lists and people only tick boxes, they cannot give you any detail. In the diary, we have specific information on the amounts, the portion sizes, the brand names, the type of food they ate, even if it's tea or coffee where the milk was added, and so on. So very detailed information, and we can differentiate between specific subtypes. So following a similar design as in the larger study that I showed you, this was a smaller study, but this is a trade-off between detail of information and the size of the study. So here, again, similarly, we have incident type 2 cases ascertained, which were also verified, and we ended up with just under 800 cases and 4,000 sub-cohort. And taking a similar approach, we applied a Cox regression with the specific design for the case cohort study. We used the residual method, but we also repeated with the standard multivariable method, and similar approach to confounding and to sensitivity analyses. So on to some results. It's a bit of a busy slide. I want you to only focus on the black lines, not the grayed out lines, only to say that they just show across thirds of the distribution of dairy intake, they show the amounts of intake, the range of intake. So we're not going to focus on those. For total dairy intake, there was a null association with incident diabetes. And when we looked at high-fat and low-fat dairy intake, now here we were able to get great granularity in our data by defining the cutoff of high-fat and low-fat at a threshold of 3.9% of fat content of whole milk, which is the content of fat in whole milk in the UK. So we use that threshold of 3.9% to distinguish between high-fat and low-fat dairy. And for either of these, we did not see a significant association in this more adjusted model. For the low-fat dairy, there was an association in model 1, which was less adjusted, but clearly confounding was playing a part. So on to subtypes of dairy intake. Again, please focus not on the gray, but only on the black. And for milk intake, we saw an overall null association. This really jumped out at us, though. Yogurt intake, we found quite a substantial decreased risk association. We have a hazard ratio of 0.72, which shows a 28% reduction in the incidence of diabetes here. And there was a significant trend across the tertiles. For cheese intake, it was non-significant. For total fermented dairy product intake, similarly non-significant. But here's the result for low-fat fermented dairy products, a 24% reduction in the hazard of diabetes. At this point, I should add that yogurt intake contributed to some 87% of the low-fat fermented dairy products. So in this population, in the UK, in the 90s, which is when the baseline of this data collection was, all the yogurt fell into the low-fat fermented dairy product category. So our conclusions from this, again, acknowledging the strengths and limitations. I'd like to think we have more strengths than limitations, but as always, there are limitations. We found that low-fat fermented dairy product, in particular yogurt intake, was associated with a decreased risk of diabetes. Other dairy types were not associated. And translating this into a sellable message, if you like, or a public health message, we worked out that in the UK, looking at the serving size or the pot size in the UK of 125 grams. I looked this up to make it US relevant. I think that's just over 4 ounces, I believe. About 4.5 of these per week basically equated to that risk reduction that I just showed you on the previous slide. So to put this into context, what have others shown? So this was what started us off into this research area when we saw this. At that point, this was based on 5 studies and around 7,000 type 2 diabetes cases. Since then, there have been 3 other systematic reviews and meta-analyses. And as you can see, the numbers have been increasing. This study had about double the number of type 2 cases. They didn't report it, but if you count it up, that's about 13 to 14,000 cases. And what's remarkable is that across all of these systematic reviews, there is a uncannily similar risk reduction for total dairy products, which is interesting that it's picked up on meta-analyses, but not on when individual studies are examined. The key findings for subtypes, this one